Hello, hello. Hi again. Welcome back. Today, I also wanted to share to you a deeply personal journey that has been a lifelong struggle, and it's weight loss. That's also a big topic of my channel that I wanted to share throughout. I've been having a difficulty with childhood obesity, and it's taking me throughout countless of diets, exercise regimens, and even medical interventions, medications. Obesity since childhood is hard, and I found myself struggling despite the best efforts of my parents. And I went to doctors to make sure my thyroid hormones were fine, that I was not diabetic, and cortisone. But it's just the weight just kept piling on. And as a child, it was often the target of cruel jokes, and it was just very bad. I grew up with very low self-esteem, and I was very, very emotional, and still I am. It took an emotional toll. This condition takes an emotional toll, and it's more than just a physical thing. It's also emotionally hurtful. After adolescence, I've tried to do everything so I could lose weight. I went to countless nutritionists. I learned to count macros. I learned to count calories. I did low-carb diets, intermittent fasting, you name it. And I've done it. And some approaches did work better than others. But the weight always seemed to find its way back. I lost a lot of weight when I was 17. I was so thin, but then it quickly went up because the body just does that. It's a roller coaster of weight loss, and it led me to need weight loss medications. So in my lasting solution, I have turned to weight loss medications in the past, of course. I've gone up and down, and I had to. I started with phentermine, and it helped me a little bit. But let me preface by saying that these medications are not a magic bullet, and they should be always done with a licensed medical professional, healthcare professional that's guiding you, and you should not be taking medications just because, okay? So what works for me or works for you or what works for him might be totally different. So always consult your doctor before taking any medical advice. That being said, I want to share with you my experiences with the various FDA-approved weight loss medications. And that's in hope it might provide some insight for those of you on a similar journey. So we're going to talk about each of these individually. And in the next couple of episodes, we're going to be talking fun ways, celebrities that have used them, and any trending topics out there. So these medications are, let's start with Orlistat, which is Ali, the brand name that's over the counter. Orlistat, available over the counter under the brand name Ali. This medication works by blocking the absorption of fat in our intestines. So when you eat fatty foods, it blocks its absorption, and it reduces the number of calories, and it reduces the amount of fat that your body absorbs, and the body poops it out. So you don't digest it, you flush it out. The mechanism of action is relatively straightforward, but Orlistat can have some unpleasant side effect because, think about it, oily stools. So if you eat a lot of fat, like a very fatty pizza or a very fatty hamburger, you're going to just flush a lot of oil. So a lot of negative feedback there. You want to try to have a low-fat diet so that you don't have that nasty side effect. Let's talk about phentermine. Next, we have phentermine. That is a stimulant medication, and that suppresses appetite and increases energy expenditure. It works by increasing the levels of norepinephrine, a neurotransmitter that plays a role in regulating my appetite and metabolism. I used phentermine when I was younger. It's only approved for like 3 months. That's the downside, because phentermine is very effective, but it's for short-term weight loss. It comes with some potential side effects. I don't like it much. I only use it when a person is very, very healthy and young. These side effects can be increased heart rate, tachycardia, insomnia, because think about it, you're like hyperactive, and also dry mouth. It dries you out. So also important to note that phentermine is intended for only short-term use, and that is 12 weeks. 3 months. FDA only approves 3 months because of its dependency potential and addictive potential. So we have to take that in consideration. The other option after the phentermine is phentermine with topiramate combined, which is Qsymia. Qsymia is a combination medication that does contain phentermine, but at low doses, and topiramate, which is an anticonvulsant drug. And this combination works by suppressing the appetite, increasing feelings of fullness, and potentially also altering the way the body metabolizes certain nutrients. While Qsymia has shown promising results in clinical trials, it does come with some potential side effects. That includes also the increased heart rate because of the phentermine, the dry mouth because of the phentermine, constipation, and cognitive also impairment. So important to also always do this with a healthcare professional. Make sure you don't have any heart problems. It's also contraindicated in certain conditions like glaucoma and hyperthyroidism. This one can be used long-term after the 3 months of high-dose phentermine, but again, there are safer options out there. Another medication that you can always use is Contrave. Contrave is bupropion with naltrexone combined. Contrave is another combination medication, but this time it has bupropion, which is an antidepressant that also focuses on dopamine and the pleasure receptors in the brain, and naltrexone, which is an opioid antagonism. This unique combination works by targeting different areas of the brain involved in regulating appetite and cravings. While Contrave has shown promising results in clinical trials, it does come with some potential side effects, such as nausea. Also, it comes with constipation. It can cause increased blood pressure. So if you have hypertension that's uncontrolled, you don't want to use Contrave. It's also contraindicated in certain conditions such as seizure disorders and uncontrolled hypertension, like I said earlier. So that's it for Contrave. Now, let's talk about liraglutide. Liraglutide is Saxenda, the brand name. Let's move up to those type of medications that have been very game changers for me. So that's personal opinion, not everyone's different again. Liraglutide has been there for a while. It's sold under the brand name Saxenda. It's a GLP-1 agonist that works by mimicking the effects of a hormone called glucagon-like peptide 1, GLP-1. This medication not only helps to regulate blood sugar levels, but it also slows down gastric emptying. Thus, your stomach is fuller longer. So this leads to feelings of fullness and reduced appetite, and you don't eat much. In clinical trials, liraglutide has been shown to promote significant weight loss, with some participants losing up to 18% of their body weight over the course of a year. However, liraglutide is not without its potential side effects, which can include nausea, vomiting, diarrhea, and constipation. It's also daily injection at the daily shot versus the other GLP-1 that I'm going to talk to you, which is not daily, it's weekly. But liraglutide is daily, once a day shot. This one is also contraindicated in people that have had medullary thyroid cancer or family history of, and medullary endocrine neoplasia syndrome type 2. Okay? Now, let's talk about semaglutide, which is Wegovy. This medication is very, very game changer. Semaglutide is also branded as Ozempic for diabetes, and Wegovy is the weight loss brand. So, like liraglutide, semaglutide is a GLP-1 agonist, but has been specifically designed and approved for weight management in the case of Wegovy. In clinical trials, semaglutide has shown remarkable results, with some participants losing up to 15% of their body weight in the course of a year. And there's some medical study that had all these FDA-approved medications, and semaglutide was the winner compared to all of them. Now, that was not including Mounjaro. We're going to talk about that later. Now, semaglutide helped me shed an incredible 90 pounds, but I did it in a course of a couple of years, like 2 to 3 years, and it took a lot of ups and downs and a lot of breaks. Every person is different. But, however, it's important to know that semaglutide is not without its potential side effects, which can include nausea, vomiting, diarrhea, constipation, abdominal pain, pancreatitis, you name it. It is also contraindicated in certain conditions, such as medullary thyroid cancer and multiple endocrine neoplasia syndrome type 2. Same as liraglutide, it's just that semaglutide is a once a week injection, so it's long acting. And it works better. So, there. Next one, new kid on the block, Tirzepatide. Tirzepatide is a new kid on the block and is sold under the brand name Zepbound. That is for weight loss. And then Mounjaro is for the diabetes brand. This medication, Tirzepatide, is a dual acting GLP-1 and GIP agonist, meaning it targets two different hormones involved in regulating blood sugar and appetite. So, two hormones instead of one. Oh my God. The clinical trials of Tirzepatide have shown impressive results, with participants losing up to 24% of their body weight on the highest dose. However, it's still a relatively new medication, and its long-term efficacy and safety are still being studied. As with other medications, Tirzepatide does come with potential side effects, the same as the GLP-1s that I just mentioned, which is the nausea, vomiting, diarrhea, and constipation, and can also cause pancreatitis, gallbladder problems, and you have to avoid it in people with medullary thyroid cancer and MEN type 2, multiple endocrine neoplasia syndrome type 2. I always ask those questions in people before starting these medications. Also, cannot be pregnant or planning to be pregnant in 2 months. These congenital side effects can happen to your baby, okay? And now I'm going to be covering with you a PowerPoint presentation that I developed that encompasses the treatment and management of obesity. And that's supposed to be done before we even start weight loss medications. And if it's someone that has had obesity problems, comorbid conditions, and has had trial and error and has not been able to be successful, of course, we can resort to these weight loss medications. But even before that, we want to go ahead and do lifestyle interventions. Let's go ahead also and define what is overweight and what is obesity and what things we should do to be able to lose the weight we want to lose. Okay, let's go. Hey again. Here I wanted to show you guys what is obesity. So this was me. This was me. So overweight is a BMI 25 to 29, and obesity is a BMI over 30. Body mass index is BMI. Now, although body mass index measures the height and the weight of the person, it's not an overall good indication of health, because there's other factors that also play an important role. Some people are having a very high muscle mass and they are a little heavier because of muscle weight. Now, that doesn't mean that they should be very, very, very heavy, because that also takes a toll on the heart. But what I mean is that there's people in the overweight category that have more muscle than fat, and that still is good. They're still healthy, because you also want to measure all the measurements, like your waist, your hips, your neck, so that you can have an overall idea. The importance of body mass index with the fat that you have in your body is that when you have more fat that you need, all of this can bring a lot of inflammation in your body, and can also lead you to have visceral fat around your organs, and causes you to have a lot of medical conditions. Like in here, you're more prone to have PCOS, depression, hypertension, high cholesterol. The excess weight can get a toll on your joints. So you tend to have arthritis because the joints degenerate faster because of the weight. Stress incontinence, mostly also in females, by pushing down the bladder. Also, cardiovascular disease, asthma, metabolic syndrome. Type 2 diabetes is very common to form when you are obese. It's a very, very, very high risk factor, actually, obesity, to form type 2 diabetes. So that's just to name a few. So obesity is not just being fat and looking at yourself. It's also a lot of medical conditions that come from it, and we want to avoid those. Now, what is low risk? So low risk or little risk is BMI 20 to 25. It's fine. But if you have higher than 20, that you consider overweight, and you have low risk of cardiovascular illnesses, but you're still considered overweight, and we need to counsel for prevention. Then goes the moderate risk people, which is a BMI 25 to 29.9 as well, or and that's with hypertension or heart disease, or BMI more than 30, which is considered obese. Okay. And high risk is people 30 or more, or that are morbidly obese, which is 35 with a comorbidity, or 40 BMI with no comorbidity. And what do we want to do? What do we want to do? We need to lose weight. And how we lose weight? We have to consume a reduced calorie diet. It can be any type of diet. There's a million diets out there. But overall, we do have to have a reduced calorie diet so that our body can burn the excess fat that's stored in our adipose cells. There are different diets out there. I'm not going to go into which one's better, which one's not. Right now, I'm just going to go say that there's a lot of diets. There's the Mediterranean diet, there's the low-fat diet, there's the ketogenic diet, there's the Atkins diet, this is high-fat protein content, there's a low-carb diet, which is a diabetic diet, there's intermittent fasting, there's a balanced approach of balanced carbs, balanced proteins, balanced fat, low-fat diet, you name it. But overall, we need to have a reduced calorie diet so that we can burn the fat that we are having stored in our bodies. The way you want to do it, it's up to you. Okay. So combination of diet, exercise, behavior modification, just having a mindset that you can do this. You can do this. And then exercise at least 3 days a week. Move. You have to move. Okay. Frequent self-weighing is important for accountability, and also regular attendance at a weight loss program, okay? It's also important to get a calorie counting app. There's a couple out there, okay? Lucid and MyFitnessPal, okay? Healthy weight loss is typically 1 to 2 pounds per week. Okay, so we want to lose 4 to 5% of baseline between 3 to 6 months. Okay, so that you improve your health. Okay, and we already gonna be talking about the FDA approved medications out there, and we're gonna cover that in just a minute. But semaglutide, which is subcutaneous, was approved in 2021 as wegovy, and Ozempic as 2017 for diabetes. Liraglutide, which was approved as Saxenda in 2014, and Victoza for diabetes in 2010. Phentermine topiramate was approved in 2012 as Quisemia brand. Bupropion naltrexone was approved in 2014 as Contrave. Orlistat was approved in 1999 as Ali and Senecal. Phentermine in 1959 as Adipex, Xion, and Fastin. And bensphenamine at 1960, phendimetrazine 1973, and diethylpropion 1959. We really typically don't use these last three anymore. I haven't actually never even prescribed this anymore. So if I give phentermine, they have to be very, very healthy. But all this above, FDA approved medications for weight loss, and we're missing one, which is Mounjaro, which is Zepbound. So we'll talk about that later, okay? The table here, it's a comparison of the weight loss medications out there. A study of 1 year of these patients. These patients were on Orlistat here, liraglutide here, semaglutide here, phentermine here, bupropion naltrexone here, and it showed that in this year, semaglutide was the one that won the most weight loss in a year time span. And the ones with the gray columns were patients who did not use any medication at all. But these people, they all thought they did have medication. It's a blind study. They thought that they were taking medications, but they weren't. So they only lost very little compared to the ones that were actually taking weight loss medications. So that's a sad story there. In conclusion, weight loss is a complex and deeply personal journey, and what works for one person might not work for another. So these FDA-approved medications can be powerful tools for the fight against obesity and for management. Obesity is really a chronic medical condition. It should be treated as such. So some people need daily maintenance medication. Some people don't. Some people just need to lose it and then maintain well, and that's it. But if you do, we just want you to be healthy and just keep going, be persistent. Remember, these medications are not a magic solution. They must be combined with a balanced diet and regular exercise to achieve the sustainable results. It's also important to be patient and persistent, as weight loss is a journey that requires time, effort, and unwavering commitment. You have to do a restricted calorie diet in order to burn those stored fat cells. So, very hard, but it can be done with strength and persistence. I hope that these experiences that I've shared with you and the medications that are being able to provide some insight and perhaps even a glimmer of hope for those of you with weight loss, struggling with weight loss. But remember, you're not alone, and we can definitely help you. I am here to help you. I am doing this YouTube channel because I believe in education and I believe in helping others. And I wish to keep this on and on and on until the day I die. So that's it for now. So take care and be sure to stay tuned for the next episodes. Take care, stay safe, and remember, beauty, wellness, and health start from within. Until next time.